technology now that can preempt brain damage from a stroke. And outside of Atlanta, it's available in Georgia only at the medical college, as Jenny Montgomery reports.
Stroke Belt is a name given to a 9-state region in the southeast with an unusually high incidence of stroke, including, you guessed it, South Carolina and Georgia. That's why a medical breakthrough available right here at the Medical College of Georgia is being called the biggest deal ever in stroke treatment.
This is our angiography suite. There are 2 of us in Augusta that do this procedure, and Medical College of Georgia is the only place you can get this done.
My wife said that I kind of turned around and slumped over.
2 months before Edward Mendoza turned 71, he had a massive stroke. Fortunately, his wife knew just what to do.
She went right up and called 911.
The ambulance arrived at MCG at 9 a.m. on July 26th.
The patient comes to our emergency room, gets transported to the room where we do these procedures.
The procedure is a thrombectomy, and it's a game changer. This computerized image shows the clot and the damage it's causing because the blood flow is blocked.
Every minute, you lose about 1 million brain cells.
Thrombectomy enables surgeons to remove the clot.
While you're going into the clot, where you deposit that net-like stent and pull the clot out.
And here's the clot Dr. Ramini's team pulled from Mendoza.
The stent retriever acts like a fishnet where you capture the blood clot and you pull it, preventing the blockage of that blood vessels and restoring blood flow to that portion of the brain. Blue arrow is highlighting the area of the brain. There is no blood. Then on the post, there are many blood vessels go into that region. And without removing that clot, that entire area of the brain would have a massive stroke, would be dead brain.
Yeah. The Wall Street Journal reported a breakthrough stroke treatment can save lives if it's available. And that's part of the issue, ensuring patients can get to a hospital with thrombectomy technology. The team from MCG's Comprehensive Stroke Center is teaching EMTs how to spot the signs of a stroke. Information like this forces first responders to be good investigators in the field.
This is one of the things we can't do anything about until we get them to the hospital. So it's real imperative that we get them as fast and quick as we can.
Within a couple of hours after they did the removal, I was moving my right side, which I was not moving at all.
Wow.
Okay. If they say, who the president, I'd just say, okay, okay. Move your arm. Okay, okay. But I wouldn't, no reception and no expressive. And within 12 hours, that started to come back.
You saw that patient in the emergency room so devastated. A year ago, we couldn't have helped, may not have survived, or certainly would have their life permanently changed.
Yeah.
And then they leave the hospital 2 days later as if nothing happened.
Mendoza was paralyzed and unable to speak after his stroke.
And within about 18 hours, I was completely being able to talk and function and everything.
And on July 28th, Dr. Mendoza walked out of the hospital. Remember the acronym FAST. Facial drooping, arm weakness, speech difficulty. All that means it's time to call for help because time is of the essence. Back to you.
Still ahead, a big opening night.